everyone, welcome to this edition of Crossover. I'm Ji Xiaojun.
Hello everyone, I'm Louisa Lee.
And today we'll be talking about, well, this is really the topic of the day.
Yes, AI again.
AI, artificial intelligence. So when we talk about artificial intelligence or AI, what would be, you know, the jargons that will pop up in your mind?
Deep learning.
Deep learning. Machine learning.
Machine learning.
Okay,
cognitive computing.
AlphaGo.
Yeah.
AlphaGo, machines beating human beings.
Siri.
Yes, seriously, yes.
Also
Siri
voice recognition.
Yeah, that's right. And there are lots of intelligent speakers now available in the market. Basically, there is someone in that machine, in that speaker, talking like Siri, helping you, searching for the sounds
for restaurants,
you're looking for.
for places that you want to go.
So AI is really happening.
Yeah, it's around us and it's inevitable.
Yeah, this is yet actually another episode we're going to have focusing on AI, but with a special focus on healthcare.
Yeah.
And in the studio, we're now joined by three special guests. We have Lancelot.
Hello, everyone.
Yeah, what do you do?
So I'm a VP of IBM China,
yes.
and I'm responsible for Watson Health in China, in Greater China region.
So I assume you know everything about AI.
Well, I hope so.
Yes.
Let's
say yes.
Okay. Yes.
Right. We have Dr. May.
I'm an AI scientist. I've been doing AI research and applied AI for 20 years in Silicon Valley.
Oh, there was AI 20 years ago even. It's not.
No, well, yeah, actually,
it's not happening yesterday.
AI started in the 1940s and 50s.
Yeah.
Really?
So
Right.
it's been around and it's gone through a lot.
Yes.
And
Even before computers, or
well, computers.
That
No,
was
it's after
after
the computers.
okay.
Same time.
Almost the same time.
We
Yeah.
have Professor Cao.
Hello, everybody. So my name is Cao Yu. I'm a tenured professor at University of Massachusetts.
Okay.
So my research areas is machine learning or deep learning and their applications to digital health.
Back to all these special terms, right? Cognitive learning, deep learning, machine learning. So you're good at all these languages. So how shall we understand these jargons, these words, say, in healthcare?
I think probably one of the best approach is to show people some real-world examples. We can use machine learning to develop a computer-aided diagnosis system.
Wait. And when you say computer learning, what do they learn?
Essentially, people are developing some algorithm, so which is a program to program the computer to learn the knowledge from either like computers from database or from other sources.
So the computer is learning on its own in a way.
On its own.
On its own.
Is not precisely. Is kind of like we teach the computer the tool, then computer will learn by themselves, but under the control of the program.
Better?
How do you learn? So how do you learn?
I might read a book, I might do some
Here you go.
practices. And
Here you go. That's exactly what we teach computer to do today.
So you teach a computer to read on its own and to absorb the knowledge on its own.
Understanding.
Do they always listen to you? Because I don't really sometimes listen to
That's
my
a good
parents.
part of a computer.
Well, you can show
Whenever
computer
we teach
pictures.
them.
Like 1,000 or maybe 10,000 dogs. Next time you show the computer a picture
Of the
that
dog,
they can
right?
recognize
Right.
this is a dog. Now it can even recognize what kind of dog.
Let's talk about healthcare.
Okay.
So where is AI in healthcare?
So AI, as a general technology, been there for half a century now. And we, all of a sudden, in today's world, we see AI is having a huge breakthrough. And we start to see which industry it applies the best. And interestingly, healthcare, it's not the other industry, become the pilot industry. Here's the reason. Because healthcare, if you look at what today is growing, right? Every year, millions of documents are being produced. No physicians today can read through all of them. But on the other hand, when you're a patient, you want your doctor to be experienced enough. Hopefully, this guy can read all this. And now, here's the AI plays a role. It says, okay, you don't read that book, I read it. I'll tell you what I read.
So I'll give you a little summary of what it is.
Exactly.
But how many data can they collect?
So
to form this AI? I mean,
I can never be corrected in the term of how many books we have read, but every quarter we're reading millions of documents.
Millions we're now
millions,
talking about.
So this is something that the doctors cannot read. You know, there's no way they can read so many articles. So the computer is reading for them.
No way.
An entire life.
Yeah.
Exactly.
Yeah.
Exactly. That's why.
So I think you're definitely IBM biased.
Like that. As a consultant, you have to be neutral.
AI in healthcare, there's a lot of applications, a lot already happening. For example, medical robotics that helps doctors do surgery more precisely, can see better than doctors, and so the doctors can use that to do surgeries much better. These robots are expensive, but they're being actually used quite widely.
And they do also distant surgery?
Yes, that's another really useful application for distant diagnosis. In a lot of areas that's lacking doctors, patients can see doctors remotely, and this is also a very important area.
So the major areas probably medical imaging.
Right.
Yeah, because this will have major impact for the radiology department. Because there are two major reasons. Number one is the number of patients is increasing a lot.
Yes.
But the number of doctors, number of physicians increasing slowly. So they're not catching up.
I mean, basically it takes at least 5-7 years to be
exactly.
a doctor, even the resident doctor.
Right, exactly. And the number two reason is technology, because the deep learning is one of the major advances of machine learning, artificial intelligence in the last few years. And one of the major application of deep learning is imaging. So the technology advances are already there. So we're trying to apply this deep learning, machine learning to the field which has huge impact on human life, which is apparently, in addition to other areas, medical imaging is probably one of the earliest fields which may have huge impact.
Yes, I completely agree with that.
Right.
I think there are actually being some pilot programs for computers can automatically read CT scans in a few seconds, and it takes a doctor much longer. You can probably call the time, maybe minutes to read, and computers don't get tired.
When we talk about these applications of AI technology in healthcare, which area are we now talking about? Only in developed countries like in the U.S. or maybe like our own country in China? Or
So obviously we start from developed countries like the U.S. First of all, technologies, is a little bit advanced from there.
More available there?
Secondary, the data is the whole foundation
There's
of
more data,
AI
right? More
technology.
Research done, right?
So
you
need
more
to have them
articles.
collected.
You have to collect
if you look at the quality, the coverage, and also the data in terms of how much knowledge in it. Actually, we're looking
research, right? You have to put all that data in.
Exactly. So that's how we see, data is becoming a huge part of it. Certainly, actually, if you want to apply to healthcare, you need a very deep understanding of the industry, the professionals, the doctors, to train the system. It's not that system will learn by itself. They're not human beings yet.
No.
So when they make errors, the physician need to correct them, and it goes through a very long period of time to learn, to train, to correct.
That's the learning process.
It's a learning process.
So the thing is, I mean, you're talking about millions of different documents. I mean, but human beings are not able to correct all minor possible errors they're going to make.
You're right, but in terms of what we're talking about, the training process is how we tune, how we make them to read through the documents and shifting through different concepts and so on. So it comes to China, for example, and other developing countries, right? So we took those knowledge and understanding and the records coming to China, apply to local markets, local records, local patient situations. That would be the next step, actually. And then there will feedback effect coming to the system again to learn the local market needs and the local market situation.
But comparatively, the documents are not, you don't have that many documents in, say, in Asia, because maybe the AI is developed in the United States, for instance. So when you come here, do you try to collect more data?
Indeed, I think there is a need. If we migrate one system from one country to another country, there is a need to retrain the system, which may be better catered for local market. That's because...
Wait, you guys keep saying market, and we're not talking about healthcare, and we're not talking about doing diagnosis. Right. And we're talking about saving people's lives.
Right.
Absolutely.
It's not only for business, right?
No,
market sounds so
no.
business-like.
Well, actually, there's a lot of that. There's a lot of things that could be shared across country. So one example I've heard is that in the medical field in the U.S., there are these handbooks, doctors' handbooks. They're basically rules that have been compiled through years of experience. First, you check this from the patient, then you ask that question, there's these step and step. So the doctors follow that, and those rules can be used
applied everywhere.
In the U.S. or here. A lot of them, I can't say everything, but
we're
a lot
all
of
human beings
exactly.
Anyway, right?
There's, you know, we share over 99% commonalities, right?
Mm.
So a lot of them can be applied, and there are companies that are inputting these rules into computers, and they put voice recognition on top of that, so they can be used as a first step by the patients to go through these questions with the machine.
Yes.
And that would save a lot of doctors' time.
How big is the gap between the developed countries and developing countries in the application of AI technology?
The technology today, I would say, has a very limited about the so-called country boundary.
Okay.
It's everywhere, right? I think the difference actually lays on two places. One is the data quality. In the U.S., everything has been digitized for a long time.
It's all collected.
And here, for example, when I talk about traditional Chinese medicine, a lot of us still here. In doctors' mind, when they do pulse checks, how you detect the pulse check, these are still not digitized. And a lot of guidebooks are not written yet.
In traditional medicine.
Exactly.
Yeah. But you need it to be digitized first before you can put into the AI system.
Yeah,
exactly.
Keep in mind, it's a learning process. It just simulates how people learn, right? They can learn Western, medicine. They can learn the Chinese stuff.
Yeah, I can't comment on the Chinese medicine, but in the Western medicine, a lot of those are shared in the U.S. and China. The same type of practices in the U.S. versus in China. The hospitals they become rules, very clear procedures that doctors follow. Yeah. And these rules may not, a lot of them are compiled experiences, or they could be how an organ works. Like if you have this illness, then you would see these symptoms. And so the symptoms, that's right.
Actually, I also went to visit a hospital in Hangzhou where they're trying to build up this AI system, which they hope in the future, because they're still building it. They hope in the future that will be a great help, not only to the doctors, but also to all patients. Let's take a look. In preparation for this episode, I visited an ophthalmic hospital where doctors are working with researchers and technicians to build an automated detection system that identifies early signs of blindness. While the system detects diabetic retinopathy through retinal images, it performs just as accurately as a highly trained ophthalmologist. This technology makes use of the same machine learning technique that Google uses to label millions of web images. It is possible, it is part of your plan to enable all these machines, or these, say, I don't know, AI machines to work for you, to at least to provide some assistance for the doctors.
目前的一个眼底的医生的工作量是比较大，那么要做一个全面的筛查呢，让所有的眼科医生这样去做是比较不现实的。中国有这么多的病人，这么多的糖尿病的一个患者，那么我们是希望通过社区医院、社区的医生帮我们进行一个眼底的拍摄，然后传到我们这个网络，对它进行一个自动的识别，然后呢达到这个全民的一个就是说对它眼底进行一个保护、预防以及指导一个治疗。
This AI-backed image analysis will be an efficient and reliable assistant to ophthalmologists. It can also be extremely useful in regions where medical expertise is scarce. It may be a few years before this AI application is fully in use at this hospital, but I look forward to its revolutionary potentials. So with this hospital, they're trying to build up this system in the future, which hopefully will help them, do better diagnosis without even seeing the doctors. What do you think?
From imaging application point of view, yes, it will help the doctor a lot. But from just a very tiny piece of the whole diagnosis process, you may do that work. But we still think the whole, diagnosis process will be directed by the doctor.
The doctors.
So this
because
is only the
when they
first
see
stage,
this,
right? This is only the first stage.
One aspect of the future
exactly.
diagnosis.
Because diagnosis usually takes multiple steps. When the information comes back to the doctor may say, okay, next step, you should go take another picture. Or you can go
even that could be automated. So I think this is a really wonderful application of AI in healthcare. It can reduce the time that a doctor uses to diagnose one patient, and so it can increase the efficiency tenfold, 100-fold.
That's right.
And so I think it's a really wonderful
So basically
application.
what they're saying is if there is a problem with the imaging of your eyes, and then the system will automatically send you a text message saying there might be some problem, you better go see a doctor. If everything's okay, they might say, you're okay.
Right.
So it's all about the imaging technology.
Yeah, it's very useful. And I think one major...
And deep learning, too.
Yeah, exactly. One major lesson we learned is, like, as we said before, AI will be very useful, very, very useful for physicians with less experiences, with less education.
I mean, on one hand, yes, it improves the unexperienced physician to improve their skills. But even for the very professional doctors, they also need to, diagnose some very rare cases.
I want to ask because these systems seem very sophisticated.
Right.
I mean, are they able to be applied in, like, all the hospitals throughout China? I mean, what if a certain place in China, a certain city in China is not, you cannot match up the technology? What happens then?
Technology availability point of view, I think it's no longer a barrier. Today you have an internet, you have mobile devices. Actually, a lot of our technology can go to the we call it the site right away. I mean, but there's obviously a cost associated with that. That's a different thing.
Yeah, there is always a cost.
Yes.
And at the same time, there is always a break. We're going to take a break now, and when we come back, we'll continue our discussion with another case study.
And for more information about Crossover, make sure you follow us on Instagram and Facebook. Welcome back to the studio as we continue our talk about the AI in the healthcare industry.
So where's the part that the AI machines are now helping the doctors?
There are actually very good process going on there, because when the machine comes out of options, it does not just give you one. It gives you multiples with a different
Multiple
side
treatment
effects,
plans, right?
different cost structure, different place to receive the final treatment, for example, surgery, where you go to have the surgery. So when that multiple options come to the place, the doctors will have a conversation with the patient to say which way you want to go. And here's the reasons, and here's the articles behind that treatment. So that's very important, because for a patient receive the options, they not only need to know the answer, they need to know the stories behind the answer.
So the question is, what's in that database?
Millions of documents, journals, and records.
About research on how to cure all these cancers?
Exactly.
So if you're given this choice, not saying that, but if it happens to you, then would you trust the machine? Would you trust the advice given by the AI system, which they say is based on millions of copies of the documents from the whole world, which is so much more richer than the knowledge of a single doctor?
There's no reason that I can trust at this point.
Not the machines.
I do not find...
Which part of it you don't trust?
Because so typically the doctors are trained on the most probable, cases, most probable treatment. So for a doctor to make a decision, I should use an alternative treatment, you have to explain why. And how do you explain there are all these different treatment variations? How many locations have been people being treated with cancer in the past? Why should I go to Shanghai, or Beijing, or maybe the United States, or maybe Mexico? Why do I make these choices?
Would you trust that machine?
Personally, I think I would trust that because, based on my understanding of Watson, it does have a huge collection of the literature, like medical, documentations, papers from last maybe 40 years. Probably, but the only minor concern I have is, are all this documentation database are in English?
Right.
So that's my minor concern is, will this be applied to people in
China.
Right. That's my minor
So
concern.
our bodies, are we all the same?
Right.
The Chinese body, Chinese people's body, and
Right.
American body?
So,
Lancelot, make a sale.
so here's how it goes. So first of all, speaking about the language support.
Right.
So the majority of cancer, let's use that disease as example here. The experience logs are today available in English, which is why the initial database or the knowledge base is based upon the English literatures. Today we're actually absorbing many other languages as well. So it's growing into a knowledge base with all type of
so
different...
the database is being enriched every day.
Exactly.
Okay.
For example, breast cancer, more vulnerable in the Asian population than the U.S. Well, if you come to the skin cancer, U.S. has 5 million patients or treatment a year, where here it's not
We have
much.
umbrellas.
Not many. Exactly. Exactly. That's how the database being enriched over time. And secondary, speaking of the confidence, I think here's how it goes. Because first of all, the system is really treated by the professionals. It's not that it's self-learn and random learn and then come out to somehow the answers right away. Secondary, whenever it gives the answer, it goes with the trace about why I'm giving this option. Here's the reason. Here's the document.
All those documents.
Here's the document. By the way, actually, we did a comparison in some of the hospitals. 100%, similarity with the patient, the physician's treatment options, and some are places actually 96%. In China, actually, one hospital just did that exercise, 96%. The reason there's one difference is because they're trying to use one Chinese local medicine, which is not in our database yet.
Okay.
So if you look at that, actually, we have built a pretty good confidence over time to say this is a very useful system.
May?
I haven't seen some evidence that someone is cured, because of this, or a comparison with not using IBM.
Probably the way to address this issue is to have a real-world data as say, for example, how many patients, as Lancelot just showed, like how many patients, how many diagnoses are really matching with the computer-generated diagnosis. So this is more like an academic way. So we have real papers, we have patents to show that like 90%, 98%, this has been verified. So if we have such kind of like concrete evidence, that would be making probably more.
But I have looked at those
concrete.
data. The match rate, what different countries, different hospitals have reported these results using IBM, and IBM suggested diagnosis and treatment compared to human expert. The agreement ranges from 49% to 90%, depending on the country and the type of illness. And probably other factors. And so, as a doctor, if I look at this, okay, maybe this disease, what is the scope of application for this particular disease? Okay, it was in that country, I take it here, how would that work? And also, even if it's 90%, in the best case, that result I've seen, it's produced at one place. And scientifically, I'd like to see the same result produced in science,
case, in every case.
In every case, because a lot of, science, it's this reproducibility.
That's right.
It just raises red flags.
I like you really a lot. May, would you join us? So there is also one more concern.
Right.
Where actually does the machine get all those percentages, basically, say 90%, 70%, this is the best choice, this is maybe the second.
So here's how we measure that. I think that the word cure is a different word than we say artificial intelligence. It's that cancer is, when it comes to a cure, it's a pharmaceutical's job, to be perfectly honest, right? It's a human being. We don't use the AI system to cure a patient. The way AI system is supporting the doctor to find the best way to treat the patient.
Well, the goal of treatment is to cure.
Well,
if it doesn't cure, that treatment.
For cancer's case, is to prolong their chance of living. That's actually the goal of today's world, healthcare.
I would be very cautious for any new discovery from the machine in the area of healthcare. Because healthcare is life or death decision. So, and any healthcare industry, any healthcare research, it takes many years to validate, to verify if it really works. So I'm actually I like to see the new ideas, new treatment from the machine, but I would be very cautious, and I would like to see like a real study to verify, like human study, to verify if this treatment really works.
Well, the fact is, it's now being used, being applied in real hospitals. One hospital in Hangzhou I also visited. I did ask the question whether the advice given by the machine is always better than the possible diagnosis or the solutions that human doctors might think of. Take a look.
Okay.
Watson for Oncology assists us by providing evidence-based treatment plans for cancer patients. But as doctors, we must review its recommendations before we put it into practice. Sometimes revisions and modifications are needed. For instance, there is a case where Watson recommended a type of drug for breast cancer treatment, which is unavailable in China, or proposes a treatment method that is unaffordable to the patient. At times like this, we would modify Watson's recommendation and put together an alternative plan for the patient.
So what do you think? I mean, would you trust the machine system?
I don't know. I mean, for me, if I want to see a doctor, I feel like I want to have this conversation with the doctor. I would, maybe the machine as an assistant, but I wouldn't want to be faced with a machine
You wouldn't know.
all day long.
You wouldn't know as a patient that, there is a machine assistant, because you'll be talking to a real doctor.
With a real voice or...
Yeah. Never know. I mean, again, I guess that's the concern that we all share, right? We cannot trust a machine, which we cannot talk to like a human being, because they're not. But at the same time, because you're the developer, you truly believe in the system, which you're still working on in terms of collecting more data to make it more, or make it better, say, for different countries, different markets, say. Well, let's hope that maybe in the future it will work. And
I think there's a possibility, but I think there's a difference between being used and being useful. And I'm not convinced that it's useful.
How long do you think it'll take for it to be useful?
Honestly, I feel this kind of diagnosis, it's a moonshot project.
Exactly. That's actually the word.
Where do you think?
Well,
where do you think the risk lies?
I think technology is, the kind of technology that's needed to be able to do that kind of text understanding and the reasoning is very, very challenging. And to call it cognitive right away, I'm uncomfortable with that.
Okay. But do you think in the future it can realize some of its functions?
It can. I think machines can be very, very useful. Can be great assistants to doctors and increase doctors' efficiency and a lot of good things the machine can do.
Cautiously optimistic.
Cautiously optimistic.
Cautiously optimistic.
Yeah, I'm actually more optimistic about this because we have been developed many technologies, and in many applications, it is actually very useful. We should be very excited to see this can be applied in many scenarios. It may not be applied for everywhere, but for certain application, like the optical hospital or other situation, it will be very useful. So if that is the case, let's go ahead to use it.
Yeah, indeed, you're in the neutral zone. Yeah. You're totally optimistic.
Yes, I am.
Well, well, I think there's a lot of really great applications in imaging.
And there are so many applications out there right now.
In terms of cognitive, this is where I'm very uncomfortable calling it cognitive.
I totally understand why people might have concerns, because there are always risks involved. Now, let's take a break, and when we come back, we'll continue our discussion. Let's talk about risks.
And for more information about our show, make sure you follow us on Instagram and Facebook. Welcome back to the studio.
So, the risks.
Yeah, let's talk about the risks.
So, what are you most concerned about?
I feel like because our data and our personal information is being collected everywhere. Every time we go online, every time we're texting, every time we're sending photos, everything is stored somewhere. And I think all that information will be used against us one day.
Well, that's the price you have to pay for being so convenient in real life,
Yes.
right? And that's the thing. But the thing is, I mean, in China, I don't know if it is happening in other countries too. If you visit a hospital, if you move into a new community, and then once you get your phone numbers registered, instantly, almost instantly, you get calls from companies concerned, say whether you're going to buy this or buy that, whether they will be interested in this or that. So if that happens with even the phone number, let's say you're collecting medical information, all these vital data about yourself, I would become crystal clear to those manipulators. It sounds scary.
Okay.
Is that one of your concerns today?
That's one of the concerns, not only my concern, but a lot of people have voiced that concerns that I've read about.
And you're purely optimistic. So what?
I would say the concerns are shared. The problem is not to say we have concerns. It's the question about how we address the concerns. I wouldn't avoid that there are privacy issues, data security issues. There are also further down the road about how people are controlling, managing that data, right? So
and who
exactly
in control?
Who exactly? So I think that first of all, when we build a system like this, it's a let me clarify it. It doesn't. When I say it reads millions of documents, it does not go to individuals' record to read who you are, your name, your age. It actually goes more de-identified data when we say that. Because the learning actually try to understand the general pattern, the rules, the knowledge, not specifically individual.
What about other companies? The risks are still there about leaking of this information, personal data.
There must be a common or like a regulation laws to be placed, and that should be strictly enforced. So to prevent this like big brother things happen. This does happen in the past. It will happen again. So there must be a very well prepared, precautious things to be placed before you can do something. So that can be but at the same time, this is double sword. Because if you have very strong regulation, and you might have it might become a barrier for
limit you to gather all the information.
You can get data. And this, I see this happen a lot in American. Because in America, when we do research, we have to apply for many things like IRB, Institutional Review Board. This kind of, it takes a month or half a year. So when we get the results, maybe the best timing has passed.
I also think there's different levels of privacy issues. If it's just a CT scan, an MRI, one image, probably people don't mind sharing that so much, and you can learn about how to identify a cancer cell or something, right? But if it's a medical history, who owns that? Personally, I think that's a very private information that even anonymized, a lot of people are uncomfortable about sharing.
And when talking about that, it seems so far that we can see in the future possibly it'll be held by the big companies like yours, who has the financial capability, who has the technology, who has the manpower. So basically, you're in the position to collect more data than other small players.
The way we collect data is not in a way like we collect, we put that in our storage and we own that. Actually, we have the very strict, the process to say, here's data stored on my place. I put that.
Is it being shared by the society, or it's IBM's data, right?
It's not IBM data.
It's not.
It's not. For personal records, for example.
Okay.
So it's just shared information.
Not shared. It's actually owned by the individual, owned by the provider of the data. To process it, to understand it, to learn it. That's how we do that. We don't necessarily put data here and we own it. This is a very important distinction when we come to the AI space.
So the best scenario would be different companies, they will be collecting information, all these data from different sources, but all these data will be put in one data bank, huge database that can be shared by all these players.
But then who owns that data bank?
That's an ideal case, let me put it this way, but it's not implemented everywhere.
No. And it's probably different, like in the U.S. and China.
No place can afford, no company or no country can afford to say, I put all the data into my place. I'm going to store it. I'm going to run it. Because this is a very distributed work.
Okay.
Yeah.
For example, for one human being, if we're talking about disease data, a few hundred megabytes. But if you're talking about your health data, gene data, that's terabyte-based. So it's a huge amount of data. If we're talking about 1.4 billion, nobody can afford that storage.
A country?
As a country.
Not even a country?
No, the country does not count up for that.
Okay. Professor?
Yes. It actually depends. Some countries, for example, in British, in Korea, one person, they can take one ID, go to any hospital, get treated, and share the data. But it's not happening for like country like China or U.S.
It's the population difference.
Exactly. It's too big, and it's also very diverse.
And that's just the disease data, the clinical data.
Exactly.
We're not talking about the health data.
Yes.
Right.
What's interesting is I read an article, and this veteran researcher, investor, Kai-Fu Lee, said whoever has the biggest data wins. Do you agree to this? Whoever collects more data wins in this AI game?
In the AI game, I would say partially yes. Actually, I have it's a good friend of Kai-Fu. But certain aspect, I would say I hold different opinion because the technology matters here.
Yeah.
It's not just data. Some tech company may own a ton of data, but can't use it.
They don't know how to process it.
Exactly.
And some companies can have smarter, more data-efficient algorithms that can actually do better than big data.
Yeah.
And that has happened.
Now, let's move on to another possible area of risks in healthcare powered by AI, say, in the future. Do you think in the future it will happen likely that, because it's so helpful, it's so useful, let's assume it's so useful, that doctors would rely on these machines so much, and somehow they would lose some of their own capability of doing diagnosis or checking up the health level of a patient? If we go to a hospital to do the health check, and basically sometimes the doctor, okay, lie down, and they will press here, they'll press there, and then breathe in and breathe out, and they'll say, you're fine. So is it going to happen in the future? Doctors are not able to do that anymore because it's always about the scanners, always about AI powered machines.
Too much.
Exactly. Without that,
technology evolves. We lose certain skills, and we gain some new skills. And today, nobody actually rides horse, and we don't have that skill anymore. But we all have the skill of driving a car. You know, down the road, it's the same thing. That
maybe we'll have
we'll learn how to deal with AI machines. But we may lose certain capability, like press here and press there, and we get the understanding. That's a perfect fun because the jobs are evolving, people's skills are evolving. And we should just embrace that for the new skills to come.
Right.
What about there is a blackout, no power, no electricity, and so hospitals being closed?
Yeah, that's where we should go back to ride horses.
Exactly. So, well, maybe unlikely that in big cities these days it's going to happen, but there is the risk that, you know, if there's a blackout.
What if the machine malfunctions, for instance?
Oh, yes.
Obviously.
So, and then,
or viruses involved.
who's responsible?
Right, so that's why there's the
hackers?
whole field of cybersecurity and all these different kind of security.
Right.
So the technology could pose problems, but it is also a big part of the solution.
Right.
Let's put that aside. Let's say everything is safe. Lancelot did mention that there might be hundreds or thousands of different players in this game. Say they're also, you know, working very hard to try to involve AI in providing healthcare solutions. So, given the choice, given in that scenario, Watson healthcare, or another healthcare powered by AI, provided by a smaller, lesser-known company, which one would you go?
I think I'll go to both, right? And see if you get the same exact treatment plan.
Well, that's a surprise. but the thing is, I mean, if we have thousands of players in this scenario, so is the fact itself a risk? I mean, with IBM, maybe it's a big company. You have the know-how, you have the technology, you have the experience, but you can't be sure with all those players.
I think, so there is this realistic thinking. I think it is a moonshot. I think a lot of the things that IBM has been promoting their moonshot projects.
Exactly.
And so therefore, as a hospital, when you make decisions, you think, well, do I have the economic resources to support a moonshot project? And I think it's important to be clear on the IBM side, to be clear about that. I think there is a possibility it could be very, very useful, but in the past there has been hypes about expert systems, about AI, and it led to AI winter.
Yes, I think, or I agree with that. Is kind of a scope. We have defined a scope of what happened, what can be applied, what may not be used for.
Again, rules and regulations.
Right, but still, as myself, I'm very passionate about the technology.
You're going to start up your own company.
Yeah, it's kind of fields which is very exciting, and this area is the technology right now is very different from what happened in the past 10 years, 20 years.
Is it going to be better than Watson's?
We'll see.
That's your competitor.
So my take actually, again, it's a technology that's available today, and it will continue to improve. And we see a great chance that today this technology can apply to healthcare. By the way, in terms of healthcare, it's not only just the doctor scenario. We're talking about the payers, the insurance company. We're talking about the government. We're talking about the pharmaceuticals. And there's so many processes today.
And also patients.
Patients.
The most important.
The consumers. Absolutely. So moving forward, I think no matter the doctors, the payers, the government, even the patient themselves will be part of that to innovate together.
Well, I mean, hopefully, because like you said, this is only the starting point. Everyone is so keen on it, and we have a lot to hope for in the future. How do we, and what can we do to democratize it and to make sure that it's going to be beneficial to more people and that can be used, can be applied in more hospitals, say?
I think there's a lot of low-hanging fruit in AI and healthcare. You can build these pre-diagnostic type of systems. I think medical imaging is more mature, and I think these can actually help increase the efficiency of the doctors. There is a shortage of doctors, especially in China. I think the statistic I've seen is 1 doctor every 1,000 patients. In the U.S., it's 3 doctors. So I think there are really, I think, low-hanging fruit that would benefit a lot of people. I would start with those.
Cautiously optimistic.
Cautiously
you believe in it, but only in certain areas.
The biggest thing I would like to see is data sharing. Because as you guys can see, data is very valuable for making the technology work. As a researcher, a professor, we already did that. We have done that, and we're going to do this to share the data. Because the more data we have sharing, the more likely the technology can help to improve life.
When it comes to affordability, actually there are 2 elements that we're proposing to many partners, governments as well. First of all, we want to apply the technology at scale. Anything at scale, it will become much affordable. Secondary, this should sooner or later get into insurance program or the social programs, so that it makes everybody, see that, experience that, and then make it available to everybody. So that's actually the route we see actually from the regulation, from the social part that will play.
So we're having this discussion. Are we now clearer about the prospect? Are we?
Yes.
I'm not.
Are you are. Changes is coming. Changes are coming.
So what about in the future? Would you trust, say, a machine system?
As an assistant, and I still would like to talk to a doctor, and I still would want the doctor to make the final decision.
Well, maybe you can make a choice out of these 3 guests. Super optimistic, cautiously optimistic. Sounds like he's in the neutral zone, but actually he's going to start up his own company.
He's going to join other tech companies.
So in other words, he's also optimistic. So which one would you trust more?
I feel like I'm optimistic, but I'm also afraid of the risk that will come about.
Okay, you're with me. Well, as TV presenters, as a host of this program, we do not take sides.
Yeah.
It is very important.
Just know that your information is...
Yeah, exactly. So it's
no longer yours.
We're only glad that we have you 3 joining us in this program, having this discussion, helping us understand more what is happening in AI, in healthcare. Once again, thank you.
Thank you.
Thank you for having me.
Your time.
Excited.
Thank you very much.
Thank you so much.
Yeah, and thank you for watching this episode.
We'll see you next time.
See you. Bye.
Tune into next week's crossover and join us with world-famous historian Yuval Harari as well as Turing Award winner Professor John Hopcroft for a discussion about the impact of artificial intelligence on our future society. Will the development of AI be beneficial to mankind, or will it pose threats to our society? Stay tuned for this whole new episode of Crossover.